For joining today. Sorry for the late start. Um, let's see. I'd like to convene the special tribal council meeting of Wednesday, December 16th, 2020. I have 9:16 a.m. Secretary, roll call.
Don Gentry,
Here.
Gail Hatcher,
Here.
I am here. Brandy Hatcher,
Here.
Clay Dumont,
Here.
Willa Palace,
Here.
Ellsworth Lang,
Here.
Rose Treetop,
Here.
Jeannie McNair,
Here.
Jesse Hicokta.
Did you hear me?
Yes. Jesse Hicokta is excused.
Okay, we have a quorum. Rose, could you do an invocation this morning to start the day out? I think we can hear you. We heard you earlier. If you could do that, I'd really appreciate it. You're muted right now. Did you hear me, Rose? Could you do an invocation for us, Rose? Thank you.
Here.
Whenever you're ready, Rose, go ahead with an invocation if you don't mind.
Can you hear
Yes.
me? Don, can you hear?
Yes, can hear you. Yes, go ahead. Rose, I think you might have intermittent
Thank
coverage.
you for today.
Oh, yeah, yeah. Rose, I think we lost you. I apologize for that. Maybe you can call in on the phone also. But if you don't mind, I'm going to do the invocation. Can you hear me okay?
Praise you.
I'm going to mute her.
Creator Blythe Alchemy, thank you for being with us here today and hearing our prayer. We thank you for seeing us through the difficulties that we're having with the pandemic and the loss. I just pray blessing over everything that we do here today, that would be good for our tribal members, our staff, our community. Creator, lead us and guide us, and thank you for being with us. We dedicate this time to you. And Creator, I am mindful of the recent losses that we've had, a family member and members and friends, and we know members are sick with the disease. We pray your covering over them and pray for speedy healing. We pray for blessings and comfort over the family that have lost loved ones and friends just recently. And we thank you for hearing our prayer and for being with us. I pray this in Creator's Son, Jesus' name, Jetsma. Amen. Thank you. And we did lose a family member, a relative of mine and a friend of many. So I'm going to ask that we have a moment of silence and to honor her and her memory and for the family. So please join me in a moment of silence. Thank you. Thank you, everyone. First up is the agenda. Are there any, this is a special meeting, I think it's too late to add additional, or is there some additional items that we need to consider?
Chairman, I do have, sorry, the resolution that we talked about with Cascade Health Alliance.
Oh,
I thought I sent it out, but I may not have.
okay, so let's add that to the agenda unless there's concerns process-wise of anyone. Do we want to do that as item 6?
Yeah, that would be fine.
Okay. So I'd entertain a motion to approve the agenda with that, as noted, with that addition of the Cascade Health Alliance matter as item number 6. Would someone like to make that motion? Okay, Member Palace, is there a second?
Ms. Ellsworth, I'll second.
Okay, thanks, Ellsworth. So we have a motion and second. All those in favor say aye.
Aye.
Aye. Aye.
Aye.
Aye.
Aye.
Okay. Those opposed, the same? I hear no opposition with my, I forgot what you call it. Abstention. Motion carries. Thank you. All right. So we have the enrollment resolutions. I see staff on. Do we have anybody from the enrollment committee, or is this something that you're going to handle, Elizabeth or Yvonne? It looks like Yvonne's unmuted.
Chairman, I lost connection here.
Okay. Secretary's lost connection, so give us just a second for her to get back on here.
Okay, I'm back.
Okay. Is this something you're going to follow through with, Yvonne, to help us?
Yeah, did you guys have any questions on the information provided yesterday?
Are there any questions? I think we'll continue to review that. I know it was provided to us. Yes. Member Palace?
Yvonne, this is Councilmember Powless. I just was wondering on the 3 tribal members that were doing blood quantum corrections, why they're included with new enrollees. Wouldn't that be something that's done separately since they're already enrolled?
Yeah, the way that it was done was their information was provided for the enrollment committee to verify their file information in order to approve the applicants that would have affected, which were the newer family members. So they're not actually, their information was provided. They are on the list because I provided the file to the committee, but they're just for corrections to be made.
So that just looks a little confusing because it looks like they're new enrollees and not just a blood quantum correction. So I think in the future, maybe I would just do that separately. So that way down the road, 10, 15 years from now, if someone's looking at that document, they understand that all that was a correction and not a new enrollment. And then I did have, I don't really have any other questions. I just had a comment about the 2 individuals that have been adopted. And I see that one is pending and one is rejected. And it seems to me like they're kind of the same. So I was just kind of wondering on the one that was rejected if they're given a chance to kind of, gather their documents. And by their date of birth, this was obviously before ICWA and things were in place. So there probably wasn't a whole lot of tribal documentation when that adoption took place. And then it's not always typical for a father to be on a birth certificate when a child's being adopted. So I just think there should have been a little more delicacy in that issue. I know adoptions are already a traumatic issue, and when someone's trying to get enrolled, I just think that we should give them a little more opportunity instead of just rejecting them, because it was just confusing to me too, again, why one was rejected and one's pending. So I think they should both be pending, and then maybe do what we can to try to help them get their documents in order.
Okay, I can review that with the enrollment committee, and, you know, with the adoptions, there's really not much information that we can, or that we have to go off of. So do you want them both to go to pending, or do you want to leave it as it is?
Well, I think the other one could go to pending and give the person a little more time to, because there's things that the person can do if they could, you know, it's just such a complicated situation when it's adoption. And like
Yeah.
I said, those, because of their dates of birth, that was before ICWA, and so the tribe wouldn't have anything, so they're gonna have to do it all on their own.
Okay, what I'm, if we move forward with the recommendation, I'm wondering if, does that have any bearing on how we address the resolutions and the attachments?
Sorry, I'm shuffling through my papers here.
I guess that's a question.
I'd like to say something, Willa, with regard to the one of the pending applicants for adoption, or that is related to adoption. I'd like to schedule a meeting about this particular person. I believe that they do have the documentation that they are required to have according to the ordinance. So if we can, I'll send out an email.
Okay, yeah, it sounds like this could be a matter that's better resolved instead of in this forum, in another.
Yeah.
Okay. So, okay. Oh, okay. I see. Okay.
That takes a while, you know, when you're, you know, documents are, those records are sometimes hard to get, and they're, you know, so instead of reject them, I think they should just.
Sure. Okay, yeah, okay, I understand. So it wouldn't have any bearing on the resolutions and attachments. Okay, just wanted to clarify that. Thank you so much. I now have a better understanding. So we have three resolutions. Let's entertain the improvement of enrollment first. That's the resolution 2020 dash 043 in the related attachments. So if we could focus on that, and if someone, we feel comfortable moving forward with a motion to approve that resolution, we'll give some folks some time. Are there any questions or
Are these the ones that are going to be enrolled? Is that what you said? I can't really
Yes.
hear.
Yes, the ones, we're going to deal with those that are enrolled, Resolution 043. Are there any questions or concerns regarding that? The resolution and those listed on the attachment? And if not, I'd entertain a motion to approve Tribal Council Resolution TC 2020-043 whenever folks are ready.
make that motion, Chairman.
Okay. Thank you. Member Dumont makes that motion. Is there a second to the motion?
I will second that motion.
Okay. Thank you, Treasurer. Secretary, I'll let you conduct the vote from here.
Gail,
Yes.
Brandy,
Yes.
Willa,
Yes?
Clay,
E.
Ellsworth,
I'm abstaining.
okay. Jeannie,
Abstain.
okay. Rose,
Can you hear Rose?
Rose, do you have a vote on this first resolution?
She's froze up on my screen, so she may not be able to hear us or respond. I guess that's one of the niggles with this, trying to do this. Yeah. Okay. So maybe I could text Rose to have her call in. Well, I'm the only one that hasn't weighed in. With my abstention, I believe that the motion carries irrespective of Rose's vote, but we'll get back on and record that for the record, Secretary. So we can move on to the next resolution.
Okay.
I'll either call or text Rose while folks are taking a look at that. And then there's the, I guess there's the rejection. And then there's the folks that are relinquishing.
So, Chairman, I'm not understanding what I should put down on the resolution for the count.
Yeah, I'm going to call. Oh, she's abstaining. Good.
Okay.
She abstained.
Yes, Rose just texted and abstained.
Okay. Maybe that's the best way, Rose, if you can hear, if you can weigh in that way, that works.
So,
And I'll encourage her to call in.
so that would be 5 yeses and 3 abstentions?
5 yes, 3 abstentions?
No, 4 abstentions.
4 abstentions? Okay.
Okay, I am. Yep.
Thank you, Rose. We got that. You abstain. Appreciate that. So let's go to the rejections.
Could you hold on for a second, Dawn? So
Yes.
Berta, did you vote for it?
I voted for it, Randy. Did you hear me?
So that would be, yeah, so that would be 4 and 4 abstentions?
I have 5 and 4.
5 and 4? Okay. I got Gail, Brandy, Willa, and Berta.
And Clay.
Oh, and Clay. Okay. Thank you.
So the resolution we're addressing now is Tribal Council 2020-042, approving rejected applicants.
I'm not able to mute for some reason. Okay.
Oh, thanks for sharing that text to Rose, Willa.
What resolution are you?
This is resolution 042. approving the rejected applicants. Are there any concerns or questions regarding Resolution 042 and attachment approving the rejected applicants?
I have a question, Chairman.
Yes.
Yeah, for Yvonne and Elizabeth, I just wanted to make sure that we are following through with these folks with the policy. They have an appeal process. There's one in particular there that I see is enrolled elsewhere, and just want to make sure that they know that they have an appeal option here.
Yeah, we will, I will let them know when I provide them the outcome of the enrollment decision.
Thank you.
Okay, if there are no questions or concerns, I'd entertain a motion to approve Tribal Council Resolution 2020-042, approving the rejected applicants listed on the attachment.
Don, before we go on, I do have a quick question
Okay, sure.
with relinquishments. When we find that someone is double enrolled, do we automatically run them through the process, or do we send a letter saying we found this and give them, I don't know, a choice as to, oh, well, I'll disenroll over there, or I'll drop off of here? What is our process?
Yeah,
I haven't came across that yet, but we would, let them make the decision as to where they want to enroll. And then if, they want to stay with the other tribe, then, we would do the process on our end to disenroll or relinquish them.
Oh, okay, so this relinquishment is by their choice?
The relinquishment?
Yes.
Yeah, those two relinquishments are enrolled somewhere else. Elizabeth had originally spoke with them. I guess they didn't know that they were enrolled. The mom, one of the gals, I believe, had said that the mom tried to enroll them like 30 plus years ago, but they were denied, and she said she still has the rejection letter, so she assumed they were not enrolled. But she said that and speaking with Elizabeth, they kind of figured that when the blood quantum changed, that they were automatically enrolled, because she couldn't figure out how they got enrolled when they had the letter stating that they were denied when they originally applied through the mother.
Oh, okay, thank you.
Yeah, I'll add to that this has been brought to our attention, of course, with them not knowing that they were enrolled, that in the future, rather than automatically enrolling individuals when their blood quantum is lowered, we will notify the individual, ask them whether or not they would like to be enrolled.
Okay, thank you, Elizabeth.
So the reason I brought this up, I wondered about the individual that's on this rejected list who meets the blood quantum requirements but is enrolled elsewhere.
Yeah, I spoke to the mom, and she said that she was told by that tribe that the kid was not enrolled. But when I requested verification, it came back that, yeah, he was enrolled. So she's kind of going through the process now to disenroll him so she can enroll him with us.
Thank you.
Uh-huh.
Any further questions, comments, concerns? If not, I entertain a motion to approve Tribal Council Resolution 2020-042, approving the rejected applicants.
So moved. This is Jeannie.
Thank you, Jeannie. Is there a second?
I'll second it.
Okay, thank you, Treasurer. Okay, all those in, Alex, you do this, Secretary, since we're online here, probably the easiest way.
Gail,
Yes?
Brandy,
Yes.
Willa,
Yes?
Clay,
E.
Ellsworth,
Yes.
Jeannie,
Yes.
Rose. I vote yes.
I don't see Rose on.
I can't see anything. Mine went out again.
Oh, yeah, we're having
Need to go
internet
back to my
problems, so
computer.
I know Rose has had a difficulty. So I guess we can note that for the record, Secretary, that,
Okay, that she was just out.
and if you can hear Rose, text us, but I don't see you on either by phone or,
So I have 7 yeses and 2, well, you abstain.
Yes.
And then Rose is out.
Mhm.
So we'll count that as an abstention.
Okay.
702.
Yeah.
Okay, then we've got one other. And this addresses the relinquishments. Let me get this back up here. Okay, this is Tribal Council Resolution 2020-041. Member Palace moves to approve this resolution. Is there a second?
This is Ellsworth, I'll second.
Okay, second by Member Lang. Any questions, comments? Okay, Secretary, I'll leave it up to you to do the vote again.
Gail,
Yes?
Brandy,
Yes.
Willa,
Yes?
Clay,
E.
Ellsworth,
Yes.
Jeannie,
Yes.
Rose. Chairman abstains.
Yes. Doesn't appear that Rose is back on yet.
So it would be 702.
Okay, 702 is the count. So motion carries.
Chairman, this is Ellsworth.
Yes.
Reading in the live feed, because there's so many that are on Zoom, if everyone would please identify themselves when they speak so that the watchers know who's actually talking.
Yeah, that's a help. It does highlight,
But they can't see that.
but obvious, yeah, folks that are
Yeah.
listening in probably can't see it, but we can see it. But yes, that would be helpful. Thank you, Ellsworth. Okay, next up on the agenda, and thanks, folks from the Enrollment Department for coming on and assistance with that. Thank you. The National Archives litigation, Member Palace forwarded some information to all of us, and both her and I had an opportunity to join on a Zoom meeting to find out a little bit more information. There's some email that were sent out with some links describing what the litigation's about. And I think folks were going to provide more information for us. They wanted to engage with all the tribes, but the state of Washington is filing litigation. You know, they're bringing forth the litigation. They're looking for folks that may want to join. Evidently, the federal government is going to close down the archives office. I keep saying Seattle, but it's actually right in that Seattle area. And folks are in there talking about moving all the records to Kansas, I believe. And Member Palace probably took better notes. I didn't even bring the notes that I did have, so maybe I could turn it over to you. You can summarize us just a little bit, and because we have an opportunity to join in the litigation, even though the majority of the legal costs are going to be borne by the state of Washington. But if you could inform us, and thanks for staying on the call when I had to drop off.
Okay. So the Attorney General, it was the state of Washington, Bob Ferguson, he announced on December 4th that they were going to be filing suit against the Trump administration for fast-tracking the sale of, actually, the way it works through the OMB is that they're fast-tracking the sale of several different federal buildings, but the National Archives in the Seattle area is one of them. With this happening, they obviously did not provide consultation to any of the stakeholders, including states and tribes. So Washington is going to be filing this any day now. And what they did is, I think they got all the tribes in Washington to join in as co-plaintiffs. And then the state realized that this impacts the other states that have things in the archives, which would include the state of Idaho, Alaska, and Oregon. So I believe that Attorney General Ferguson reached out to the attorney generals from the other 3 states. And then the tribal liaison for Washington Attorney General is Asa Washings, and you guys might remember him because he was here helping us with the census. And he since has left that position and is the tribal liaison. And he had mentioned to the Washington Attorney General that Oregon tribes and Idaho and Alaska should also join. So they sent out an email. Me and Chairman Gentry, as he stated, joined a meeting with them last week to kind of talk about it. And so today, the ask of Tribal Council is if we should join on as co-plaintiffs. And as Chairman mentioned, it won't be too much of a legal cost unless the only cost we would incur would be any supplementary documents that we would include. And so we would have to talk to our attorney about that. But we can't state enough how important the archives are and that the tribes didn't get consultation. And I know Chairman really shared the importance of us being a terminated tribe. We lost a lot of our records, and a lot of those records are housed up in the archives. And once that sale goes through, they'll be moved to Kansas, and that would even further harm our people that do research and spend time in the archives. They would have to go all the way out to Kansas to do it. And so it's really important that we join this lawsuit and show support. So we would just be joining as a co-plaintiff.
Yes, and the additional documentation would be anything that we think would be helpful, whether it's affidavits, talking about the importance of the archives and any kind of supplementary documents that would be provided to the court, expressing our concerns, whether it's letters or I'm not sure the formal documentation, but it's obviously, I believe it's a significant concern of ours. And we may be able to get the assistance of, we would, not saying we'd have to generate any document completely by our attorney. We have some of our folks that really could attest to the importance of the archives. I know Kathy Hill, really, when she lived in that area, who was a part of our restoration effort and really was involved in helping to draft testimony for our tribal members in support of restoration, really relied heavily on those documents and statements that are on record there of our members, so it's important history for us. And so we thought, I thought, and Member Palace and I think others would think that this is important for the Klamath tribes to join on and support this. Yes, Member Dumont.
Yeah, Chairman, I believe that our Culture and Heritage Director, Perry Choctoo, was involved in early meetings on this, and he may want to weigh in. I see he's on.
Oh, yes. And yes, let's Member Palace first, and then Perry will go to you if you'd like to chime in.
I just want to say that this is a nonpartisan issue, because there's several things that are housed in that building, not just tribal documents, obviously, which we're all aware, but, because then, one thing the Attorney General did share is once the new incumbent, Biden administration is, inaugurated, this will become a suit against the Biden administration. So again, this is not a partisan issue. This is just about, keeping those records accessible to the people that need them.
Yes, Perry?
Yeah, good morning, Council. I appreciate your time today. I attended a teleconference with the Army Corps on the 18th of August this year, and all 9 tribes were on it, and I expressed our disappointment in not consulting with us earlier on just the concept of moving what they house at the Seattle Archives. Several other tribes voiced their disapproval of the movement. We spent probably about an hour on the phone talking about it. The representatives of the Army Corps of Engineers really didn't seem like that they were interested to hear what we had to say. It was like they were just going through the motions. There's a couple examples, I believe, Section 106 was violated. First, in coming up with a concept, and then not having meaningful consultation with us, and just listening to what we had to say. It seemed like they had their minds already made up. They were supposed to get back to us, and then they never did. And so, my idea is that we need to follow suit with the rest of the tribes and file some type of litigation or jump on some type of litigation. It's nice to hear that it's not going to cost us a lot, but our recommendation would be to follow through with it. The government's just doing what they want, and it's without consultation at all. And Councilwoman Palace is very correct. It houses more than just paper documents or recordings. They hold materials. They hold ancient descriptions of our ceremonies relayed to them by tribal members, our ancestors that aren't here anymore. So it's important for us to have the ability to go someplace close, and Kansas is not close. So, like I said, our recommendation would be to get on some type of litigation that could either reseat this. Having a new administration, this might not go through, but that could be just a hopeful pipe dream. So, like I said, I feel that we need to litigate. It's nice that it's not going to cost us a lot of money. They refuse to consult with us, and I think that comes right from the very top.
Thank you, Perry. Appreciate that. Any other comments, thoughts of council members on this? I would entertain a motion to move forward and join the litigation with the state of Washington on the National Archives matter. Okay, Member Palace made that motion. Is there a second? Member Dumont, I see, raised a hand there. Okay, Secretary, if you could conduct a vote.
Gail?
Yes.
Brandy?
Yes.
Willa?
Yes?
Clay?
E.
Ellsworth?
Yes?
Jeannie?
Yes.
Rose? I vote yes. Chairman abstain.
Yes, and I don't see Rose's on. Is this your number, Rose, 783-7529?
That's the casino number.
Oh, yeah, that's right. Okay,
Sorry, we need to remember to announce ourselves for the online.
yes. Okay, I don't see Rose on here, so we'll treat it like she stepped out of the meeting for a moment. So just document that. Yeah. Okay, next up, we have the operations plan. I'm not sure what documentation we have related to this and how we're going to move forward, but we've got a lot to consider here. Any thoughts on how best to handle this? We have, are we looking for a report and recommendations from our tribal entities?
Chairman, this is Vice Chair. I did ask Misty if she would be sure to be here today so that she could kind of give us an update of where we're at so far and her recommendations.
Okay. Yeah, that's, I appreciate that. That's a good way to start out because we're obviously concerned about protecting our community and our staff. And so, Misty, thanks for joining us. And also, Misty, I just, on behalf of the council, we appreciate your good work and representing us in the media so far and doing all that you're doing to help us. So thank you for the excellent work.
Thank you. I'm glad to help as much as I can through all this. So I went through over the last few days and gathered some data, and I did email it over to Roberta this morning as well, so that there is some actual images for you guys to look at as well, some charts of actual numbers for you as well. So I'll kind of give a big picture of what things are looking like and then kind of narrow it down to what we're facing in the clinic and locally. So Klamath County is still considered an extreme risk county from what Oregon Health Authority is giving us. The positivity rate in the county is still really high for COVID testing. It's at 12.5% of cases. That is down a little bit from 13.2. Over the last month, that's 756 cases of COVID per 100,000. But the last week, we're actually at 2,100 cases per 100,000 citizens, which is really, really high. And that's actually a case rate that's really similar to what they're seeing in Portland. We've started to see some outbreaks in senior care facilities. 3 facilities in Klamath County now have cases. We've seen some large workplace outbreaks. Masami Foods in Klamath had 32 cases. For the hospitals in the region, the HOSCAP system, which tracks all of the hospitals in the area, as of last night said there was 0 ICU beds in Region 7, which is 8 counties, including Klamath County. And in non-ICU beds, there was 81 beds available in all 8 counties. So very, very minimal hospital resources available. I went through and looked at all of the individual hospitals, what they were reporting, since they update twice a day, and OHA only updates once a day. And Sky Lakes did say they had 2 ICU beds available, but it looks like we have a significant amount of COVID patients that have been hospitalized all across Southern Oregon and have very minimal resources available for healthcare across the board. For what's happening here within the clinic, we're averaging about 20 COVID tests a day. We've been seeing about 2 to 4 positive COVID cases a day, which averages out to about a 10% positivity rate for us. So we're definitely seeing quite a few people that are testing positive. You look at the numbers that are on the screen for you. This is just December to date, so only 15 days. And then I have also the numbers for November on there as well. So this is looking at our employees for all the different tribal entities, how many people have developed COVID within the tribal employees, how many have had high-risk exposures, have developed major symptoms where I'm concerned that they have COVID, even if they tested negative, and then compared that to November's rate. So in December, even though we're only 15 days in, we have already exceeded the number of COVID cases and employees that we had in the entire month of November. Our high-risk exposures are getting close to where we were in November already, and those with major symptoms are very similar already. So we're seeing quite an uptick in the number of COVID-positive employees. The exposures for our employees are not happening at work. A lot of what I'm seeing is people who unfortunately have family members who have been exposed maybe at their place of work, and then they come home, and then the employees are exposed via family members. So it's not really an employee-to-employee spread, like in the workplaces, or employees getting COVID from patients like at Klamath Tribal Health, like at the Wellness Center. It's spread within the community that we're so we have a huge number of our employees that are starting to have significant risks that they're seeing in illness. The other thing of concern for us is we are starting to have, with all of these, these numbers going up with COVID positives and high-risk exposures, we are starting to have some significant shortages in nursing staff here at the clinic. Our baseline nursing staffing should be 6 nurses and the nurse supervisor. As of today, because of high-risk exposures, as well as one of my key nursing staff needed to take a mental health leave because of COVID stress, I'm now down to 1.75 nurses for the entire wellness center. So we're significantly short-staffed for RNs right now, just as our COVID numbers are starting to spike. We did put in a request with OPSEC, with OHA, to try to get temporary nurses to try to support us, but we're kind of reaching a critical place where we have cases that are increasing in the community, and difficulty with maintaining healthcare providers and keeping them healthy through it all. We have the light coming, and that vaccines are going to be on their way, but that does take time to start unrolling, getting those out and coming out into the community. So I'm definitely concerned with, how the numbers look, knowing that we have Christmas coming and that we had an initial spike with Thanksgiving that was really significant, and we haven't seen that really plateau yet. So I'm concerned that we're going to see an even bigger spike after Christmas. So that's kind of my update for everyone.
I appreciate that. I think there's interest in talking more about the vaccines and what's going to be happening with that. But I think we probably want to discuss, is there anything, it sounds like a lot of the infections are coming from outside our facilities. I'm just wondering if there's any thoughts of what we can do in addition to what we're doing to protect staff and our tribal members in the community. It seems like we're employing the provisions and doing what we can with our entities, but I didn't know if there's anything that folks are thinking might be an addition to what we're doing that could help.
It's hard. I actually had a meeting yesterday with both CDC and the Northern Portland Area Indian Health Board, and spoke with them for about 2.5 hours, going over all of the protocols that we've been utilizing, all of our infection control, and they didn't have a lot of concrete changes that we could implement. They actually thought that we were being too stringent on some things that I've been implementing here in the clinic to try to reduce employee-to-employee spread with the personal protective equipment. They thought that I was being a little heavy-handed in the amount of PPE I've been requiring people to wear. And I, kindly disagreed with CDC and said that I was going to make sure my employees weren't passing COVID around to each other. They really didn't have a lot of guidance for what we could do other than, continuing to make sure people were socially distanced and encouraging remote work. I did tell them that we had been utilizing, for the most part, trying to maintain 25% of employees on site for a lot of our facilities, and they said that was one of their greatest recommendations at this point is continuing to maintain as much telework as possible, because they are seeing so many people having workplace outbreaks. So they were really pleased that we have been implementing that, because that is something that protects a lot of people at this point as well.
Thank you. Are there any other questions related to this topic or the report? Or, I mean, I don't think we're entertaining relaxing anything at this point, especially given the data that's in place and the ongoing concerns. And I know that we're not even thinking about opening up the casino and hotel until later on. And not really optimistic myself that it's going to be safe to do much more than what we're doing right now. So we'll just have to see. I mean, that's with Christmas and New Year's, we don't know all the implications it's going to have, on the community. And but are there any other questions or comments of Misty, related to that before we dive into some questions and a summary on what's happening with the vaccines?
Chairman, are we going to discuss the vaccine now, or are we going to have a different forum for discussion of that?
Yeah, I guess there is some, well, maybe, Misty, maybe you can explain to us what's in the works, perhaps. We know we do have some flexibility of consideration on how we're going to administer that to our elders and so forth, and we might have some heavy discussion about what we can be doing with the available vaccines and how they're coming in. So I know the Tribal Council is interested in weighing in on that. So maybe that would be better to do in another forum, but if you can at least let us know what's coming and when it's anticipated. I know we're working with the state. Some tribes are working directly with IHS, and there's a difference in the vaccines that are available and when they're going to be available. So maybe we could start with that and just update our members on what is in the works. Then we can have more discussion in a different forum, I think, with all of the council and others to have more of a detail to see what flexibility we may have. And I think the priorities in general that we're hearing across the nation seem to be consistent with what we're concerned about. But we do have some flexibility. We probably want to talk about that in a different forum. Thank you, Secretary.
We have, so there was two different options for vaccines and the source to obtain them from. There was initially the opportunity to obtain them from IHS or Oregon Health Authority. We did opt for our vaccines to come through Oregon Health Authority, just based on our working relationship with them and the ability to have a strong relationship with reporting and consistent ability to get the vaccines and everything really rapidly through them. And also the information they were providing had much less of a political spin to it and much more of a scientific direct approach with actual data being provided to us. So with that, we actually have been on the forefront of receiving data on the vaccine. I had a meeting with Public Health for Klamath County on Monday, and we actually have received numbers on how many vaccines we're going to be receiving, where no one else in Klamath County has actually gotten that data yet. So we are probably one of the first places in Klamath County that will start to receive vaccine for COVID-19, which is really encouraging. So definitely a good move for our coordination with OHA. The two different options for vaccine were Pfizer and Moderna. The Pfizer vaccine was one that was very difficult for areas that are rural because it required really extensive cold handling, where you had to have it frozen down to negative 80 degrees, handle it in a really specific way, and you had to be able to administer 750 vaccines in a really rapid amount of time. And if you didn't administer those vaccines, then they were wasted. And also had some more side effects associated with it. And they've looked at, with the Pfizer vaccine, that it wasn't the greatest because of that, not utilizing it in rural areas. So with that, we were allocated 150 doses initially of the Moderna vaccine. The Moderna vaccine They're anticipating emergency use authorization to be approved probably tomorrow through the FDA, and then the final signatures on that to come through this weekend. If that happens, then they anticipate shipment of the Moderna vaccine early next week and potentially having it in our hands on the 23rd. If that happens, our goal is to begin initial immunizations potentially on the 30th, depending on, if it does come at the time frame that we're expecting. So we've been looking at that, kind of polling people to see how many people are interested, and we've been receiving a lot of calls at the clinic from people, wanting to know about the COVID vaccine and availability. The Moderna vaccine has very minimal side effects. From what it looks like, the safety data is great. I watched about an hour of clinical data yesterday, and it looks like a great vaccine from all of the side effects are actually fairly minimal considering, what we were expecting initially. And as someone that's a pretty skeptical person and wants to see the evidence, I walked out of that meeting feeling very confident in saying that it was a good option for our community. One of the factors they also brought into the meeting yesterday was they actually had participants from the American Indian and Alaskan Native community in their trials, which was not something that the Pfizer trials had included. So they actually were able to provide data showing that it actually had positive outcomes that were actually applicable for our community, which was really nice to see as well. And they'll be releasing those in their data. So that's my update on vaccine. We're working to make sure that we have all of our patient data and everything ready to go as soon as we have vaccines in our hand.
Chairman, this
Yes.
is Gail.
Yes.
Thank you, Mindy. I really appreciate your updates. You give us such good information. I really appreciate that. Chairman, I just want to kind of back up a little bit and get back to the update regarding where we are as far as the uptick, what we're looking at. I believe we're supposed to make decisions today as to what the casino and hotel is going to do, and the rest of the tribal entities as far as remaining as is. Are we opening up more? I think we need to get onto that discussion because we do have other topics we need to get to as well.
Sure. Well, I'm not sure if we're going to be prepared if we have all the information that we need to make an informed decision. I mean, Congress is considering another package. We need to have a good understanding of where we're at as far as what we've expended with the CARES funds. That could relate to what we can provide to our members, whether we stay open or for an extended period. It might have some...
Mr. Chairman?
Yes.
We need to decide, we told employees we'd have a decision by Friday.
Yeah.
So we got to make some decisions today.
Yeah, I mean, I'm just throwing this out. We can decide to make a decision based on the information that we have. And the reason I was mentioning the additional package, it is information that would be helpful for us if we know what Congress is doing that might help us to plan what we're doing in both operations and with the CARES funds that we have remaining. So, so council members, if you want to weigh in, Secretary, I see you'd like to speak, so.
Well, I think we could at least make a decision till the end of the year. Because we've already kind of gamed that out with the CARES project application through the casino. And as far as the administration and health, that doesn't necessarily affect what we're already doing because we're not closed. We're just open for appointment only.
Okay.
Hello?
Yes, is that you, Brandy?
Hi.
Yes, did you want to speak or whoever? I think that was Brandy that weighed in, but I see it's muted now. So,
Ellsworth?
Yeah, Ellsworth?
Yeah, so we heard from Misty, and I love the information that she always puts forth for council on the numbers and what the county is doing, as well as what the tribes is doing, and how many healthcare professionals are able to basically, take care of future folks, outbreaks, positives, how we're doing testing. I think one thing that we do need to hear is a short update from the casino on this as well, and where the GM for the casino thinks that we're going, or thinks that we can handle, given the two cases that we've had in the hotel and the casino, and what that actually did to the operation as far as staff being able to stay open or close, so that we can properly forecast, if we do have another positive, what it does to the operation.
Okay. Yeah, Joseph, if you'd like to let us know your thoughts and even recommendations, that'd be helpful.
Okay. Well, good morning, Council. Thank you for having me here. Misty always has great information, and she's been really a stalwart partner of the casino and the operation, and in keeping us well informed and giving us some information or some guidance on where we're heading. And in addition, the Oregon Health Authority is now providing on Mondays their guidance or where they think we're going to be in terms of extreme risk or whatever level the risk is going to be. They're providing that on a Monday for the following week. So you get a little heads up from them, but there's so many variables, and I think once the vaccine starts to kick in and people are taking it and it's adopted, that there may be some light at the end of this tunnel, not the train. But I'm concerned about reopening the casino and the hotel on a number of levels. The first level is, there's not a strong business reason to open for the next week or so, because it's the slowest traditional week of the year. Obviously, we'd have New Year's Eve in there in the mix somewhere, and that's the strongest night, or almost the strongest night of the year, sometimes depending on your marketing. But I'm worried on the disease side of this, and you see positives from Misty's report, and we don't even have spread amongst employees. This is outside of the operations, and so I don't know where we are in terms of the Thanksgiving surge, but as we move forward here, there's the anticipation of a Christmas surge of people getting together again and doing things in groups that they probably shouldn't be doing, and then you'd have that surge rolling on into New Year's Eve. And I don't know how, unless there's some dramatic difference in disease levels, I don't know how we could, in good conscience, be open on New Year's Eve and have a big New Year's Eve event full of people when we're worried about these. We're worried about the members of the community, we're members of our teams and our staff, and their health and their well-being, and how we could do that. We are, as it turns out, not the only casino closed right now in the state, and I know that the other one has published that they were supposedly opening like we were on the 18th, and they've said that they're not going to open on the 18th, and they're not sure when they're going to reopen. And what I would recommend to council today is that our employees deserve an answer when what's going to happen, and so I would like to be able to tell employees, I don't anticipate reopening before. We wouldn't want to be open on New Year's Eve or the 1st. We could try the Saturday as a date, or the 4th, but leave it vague and open to the public. That we'll be in touch. We'll let you know. We're considering the health and safety of our employees and our guests, and it's based upon the health concerns. But I would recommend that we not reopen. We have talked about CARES Act funds through the end of the year. I've sent council some numbers that I think don't look disastrous. And so I would hope that we would be able today to say publicly, keep in touch and we'll let you know when we're going to reopen, but be able to give the staff a not before date of when we plan to reopen. And then we can keep our options open as we move forward to the beginning of the year.
Thank you, Joseph. Member Dumont?
Yeah, this is Clay. First of all, thank you, Misty. I really appreciate the updates as well. The 10% positivity rate is really scary and alarming, and to see that we're right up there with Multnomah County and some of these worst numbers, that's scary stuff. For those listening in, I want everybody to know that our casino general manager and the financial staff over there, as well as the financial folks on the admin side, and our general manager have done a wonderful job in making prudent decisions about the budgets. I'm very confident that we can get through the end of the year in good shape financially. There's been a lot of work to make sure that those CARES Act dollars that can reimburse us for losses, they can't reimburse everything, but they can certainly help. And everybody's been really good about that. Secretary Frost has done a lot of work to make sure that those dollars come through. So I feel good about getting through the end of the year financially for the casino and the hotel. I recommend that we stay the course, we remain vigilant. I think there's a potential for folks out there to get complacent when they know that the vaccine is coming. And that's really scary when it's happening at the same time as the holidays and people are trying to gather together and do things that they shouldn't. I also very much worry that the rest of Klamath County is not nearly as vigilant as the Klamath tribes are. And I hate to think about, folks coming in from outside and getting in the casino in an indoor place and not being vigilant about the virus. So I'd recommend that we stay closed until the first week of January and reconvene at that point. I'm not sure if that needs to be the Wednesday when we'd have a council meeting, or if the secretary has a recommendation about that. But I'm not in favor of opening up.
Thank you. Any other comments or thoughts of council members?
Chairman, this is Ellsworth.
Yes.
With all the information that we're given on the tribe's positivity rate, I'm in agreement with holding off on opening. And I love that the tribes take it very serious on the health of our people before money. With obviously the casino is a large producer for the Klamath tribes and does send over money to the tribes. However, there's some mitigation in there for CARES Act funds to help us out. But I think the health and safety of our people in this case needs to be at the forefront, and it's appreciated that the tribes has taken this very serious, that the GM at the casino, admin, and the travel center are also taking this serious to protect the health and safety of our people, our staff, and also the community members, because if there is an outbreak at an event such as a New Year's celebration, and that given that there's not a lot of businesses and community events that are open that could hold an indoor event like the casino because of our sovereign abilities, and if there were an event that we hosted, it could be a huge outbreak amongst the community, given the folks that travel from Klamath Falls, the folks that are from the Chiloquin area and surrounding areas that could all be in there, and it could be disastrous. So I would not like to see us pull the trigger to open as well. And I do know that the other casino, that is a very large one in Oregon, is thinking about the same thing for their staff. their tribal members. So I appreciate these thoughts that we have for our tribal people and our staff.
Thank you, Member Lane. So I believe everybody's on the same page of not opening up the hotel and the casino. We could pass a motion to that effect and maybe specify a date that the tribal council would reconsider that. The first Wednesday of the month's not a regular meeting, but it looks like it's open on my calendar. Would that be a good date, Secretary, to extend the closure and for the tribal council to reconsider at that time?
We could meet on the 6th. Is that the date that you were talking about, Joe?
Yes, that's what I was thinking. It'd give us a little bit of time to gather additional information after the holidays. I'm not sure how much more health information we'd have, but at least maybe we'd have an understanding of what happened during the Christmas event.
Would we want to make the closure effective like until at least that Friday? So we need to give the employees a few days after we make our decision to be ready.
Yeah.
Would that be sufficient time if we decided that we're going to open? Joseph, I'm looking at you. If we decide made the decision on Wednesday, is Friday too soon?
Yes.
Yes, it's too soon? Okay.
Yes. I need, in terms of, the restaurant getting food in and their delivery schedule, I think they don't get food until Thursday or Friday, and so they need some fresh food in there. So I'd need a little more leeway than that, please.
So if we had it on the
4th in the afternoon, perhaps?
The 4th is a Monday. So how many?
4th of the month, I believe that would work. I'll probably get in trouble with Rachel when I get done. I didn't figure enough time, but I think the 4th would probably work.
So we could have a meeting on the 4th to decide for a reopening date. And I guess we could discuss what that reopening date could be at that time. And it may not even be that week.
Yeah. Does that sound like it would work? If so, we could wrap those into a motion to extend, do we want to specify a date at least to the 8th? And the tribal council will reconsider that on Monday the 4th? Would that work?
I think it would make sense just to find the meeting date to make the decision, because we don't know what's going to happen, and it's easier to decide from that date when we can open up.
Yeah. The only reason I was going to say...
How about if
Go ahead, Joseph.
I let staff know that we won't open prior to the 4th, but that reopening is subject to council approval, and that date can be, whenever you decide to meet and whenever that is. And then, I can come to you with, how much time we need from then to get the orders in, because the hotel has to stock up with food from basically zero, and we still have frozen stuff in the casino, but we'd have to get some stuff in, so.
Yeah, the only reason I was thinking of specifying a date, or at least until sometime, it gives staff an understanding of where we're at, and because I wouldn't expect us to open up on the 4th. We would consider when we would. But so I was just trying to, as much as possible, let folks know what to expect.
Chairman?
Yes, Member Dumont?
Yeah, this is Clay. I think I appreciate Joseph's recommendation that we meet on the 4th and see where things are. Given that Misty said we're not likely to see any vaccines, even the very few, until the 30th, I just can't imagine that, we're going to be able to set a date in early January and be able to push this thing forward safely. So I think we just meet on the 4th and we reassess where we are.
Okay.
Chairman,
Yes.
what I put down as a draft for a motion is to extend the current operations plan until a date to be specified at a special tribal council meeting on January 4th, 2021.
Yeah, I think that'll work just great. And then we'll do our best to let folks know that it's going to be based on, the health situation here. And we're not expected to open up on the 4th, even if a decision is made, for sure. So, but I think,
That's a Monday, so we'll have that OHA report for the following, what they see for the following week, whether, but I think I'd rather hear what Misty has to say at that time than what they have to say.
sure. So does the motion sound, I think that motion will work just great, the way you put it, Secretary. I'd understand that motion if somebody would like to make it.
This is Brandy. I can make that motion.
Okay, thank you, Brandy. Is there a second? Member Dumont, I see raised a hand there. Okay, all those in favor, Secretary, I'll let you conduct the vote.
Gail,
Yes.
Brandy,
Yes.
Willa,
Yes?
Clay,
E.
Ellsworth.
I abstain.
Thank you. Jeannie,
Yes.
Rose is still out. I vote yes.
Okay, of course, I abstain per the bylaws. So the motion carries?
Motion carries 6-4, 0 opposed, 2 abstentions with Rose out.
Great, thank you. Appreciate that. I'm glad we came back to that. I was hoping I knew we were going to get to this before the end of the day. So appreciate that. I'm wondering if we wanted to revisit the vaccine. I did have a question about the vaccine. Do we know how many doses that we would get, Misty?
So they're giving us 150 doses initially, and then a week later we'll get another 150 doses. So that's for 150 individuals since it's 2 shots for the full series.
I see.
So that will only do 150 people initially. That's just the first round, which we have to make a decision on who we want to prioritize that with. So we have to have that whole discussion about allocation and where we want to prioritize that. After that, they'll give us a larger allocation, and that's where we should see much bigger numbers of vaccines start to come in as they ramp up their production. I don't have numbers on that at this point. They were just able to give me what our initial allocation would be in that emergency priority scale. So.
Great. Yeah, I know
Misty?
this. Go ahead, Jeannie.
Misty, this is Jeannie. I do have a question. I missed the meeting yesterday, but within vaccine, was there any mention about any side effects?
Yes.
Especially for the elders or somebody with like diabetes and high blood pressure and such?
Yeah, so the vaccine was actually studied really well between the ages of 18 to 90, actually. So they did a pretty wide spread of ages that they studied. And it was pretty well tolerated across the board. The first vaccine did, almost everyone had, the aching arm, similar to when you get the tetanus shot and your arm hurts at the site of injection. That was the most common side effect after that injection. The second dose, which is a month later, had more side effects. Most people reported that they felt very tired after that first injection, and about 15% had a fever after that dose. And the fever kind of ranged from mild to a very small percentage had a higher fever with it. There was also a good amount of people and I can't remember the percentage off the top of my head, that had some lymph node swelling on the side of the arm that they got the vaccine in. And that was actually a good thing, because it was the way this vaccine works is it teaches your immune system how to fight against COVID. So it doesn't give you like the traditional vaccines that we usually see would be either like a live or an inactivated virus. This one actually teaches your immune system how to fight against COVID without actually ever introducing COVID to you. So what you're seeing is your lymph nodes might have some swelling because your immune system goes into like hyperdrive kind of to fight against COVID, because it's learning how to do it. So you might get a little bit of lymph node swelling, but for the most part, it's really fatigue and possibly a fever. That was the biggest side effects. They didn't have, Pfizer had talked about anaphylaxis. They didn't see that in this vaccine. So the side effect profile looked really good across the board.
So the way I heard it described, the side effects really indicate that your system is gearing up to fight the infection. So it's not like, it's basically can potentially be perceived as a positive that the vaccine is actually working. Is that correct?
Yeah. So the side effects it's a good sign that your body's actually producing the immune response to learn how to fight this off. So having the side effects is actually a good sign that you're producing the antibodies and that your body will develop the immune response to fight off COVID. And it is about 95% effective. After the first dose, that is a 2-dose vaccine, after the first dose, it was 80% effective. So it definitely looks good in terms of efficacy.
Member Dumont, I see your hand.
Yes, I think you may be answering the question I wanted to ask. I saw a news report yesterday saying that this vaccine actually would prevent infection as opposed to simply preventing severe illness. Is that what you're telling us?
Yeah, so that's what they're talking about. So what this does is the COVID vaccine has a specific protein, or the COVID virus has a specific protein on it that is very, only COVID, or SARS-CoV-19 has this protein on it. So what this does is it shows your body that protein wrapped up in these lipids, and your body learns that this protein is something that it needs to fight off. So your body gets this immune response to that protein, and it produces cells that can go and fight off against that protein. So your body learns it and fights it off. So it should be a preventative thing over the long run. It's actually some great technology that they've been using, immunotherapy in cancer treatment. This is something that they've been focusing when you saw people that used to get really, really sick back in the 60s and 70s from chemo, and they would just be critically ill. And then you see people now that do really, really well with treatments. This is the same type of therapy where they've been developing these specific therapies over the years. So it's something that's actually been really well studied and developed over the years. So good technology.
Secretary, I thought I saw your hand raised.
Yeah, I was wondering if, Misty, can you tell us the amount of people in the trials and then what the percentage of Native Americans were in those trials? Or
yeah, so I don't have an exact percentage. The number was small of Native Americans in them. The total population studied was 30,000 in the trial. They did have, it was only 150 Native American participants, but they were actually able to say, hey, this is how many people volunteered that were Native American, this is what their side effects were, and see if they wanted to do expanded data collection, because they think that they had more people that were actually Native American but didn't disclose their actual blanking on the words there, but they didn't actually list their demographics. So.
Misty, in addition, 1 minute. In addition, good morning, Chair and members. From the Pfizer's study, they had 300 Native Americans, and for the Moderna, they had 150 to 200 Native Americans out of the 30,000 populations they studied in the trials.
Oh, thank you, Doctor. Jeannie, did I see your hand there? Oh, I see. Did you have a comment or question, Jeannie?
No.
Oh, okay. So, well, thank you. Yes, Member Dumont?
Yes, Chairman, I'm wondering, do we need to have a formal vote about the prioritization? I see the Secretary shaking her head no. I mean, I'm certainly in favor of following the suggested guidelines and getting our frontline medical people vaccinated first. And so if that's the case, I'm wondering if Dr. Olerbe and Misty have a sense of how many doses are going to be necessary to do that.
Thank you.
Yeah, for our for the healthcare team, we have about 80 individuals that would be considered healthcare providers. So either having direct or indirect patient care. So that would be our teams here at the Wellness Center or with dental and pharmacy. So that would be the staff that would be requiring the vaccine. And that definitely would allow us to ensure that patient care continues through this until we have enough vaccine to, do mass immunization as people throughout the community.
Member Palace?
So would that 80 come out of the 150 allocated to the tribe? And if so, are we talking to people that are opting in to take the vaccination? For example, if people have the option of getting it somewhere else through a private healthcare provider or the VA, stuff like that, are we looking at that to help spread those vaccinations a little further?
So the initial vaccines, the first rollout, they're giving them to healthcare providers for administration to their staff only. So the only way healthcare providers of any sort can get the vaccine is through their employer for that first round. Afterwards, when it becomes more widely available, then it will be available like through primary care providers and different things like that way. At this point, the only way they would be able to obtain it would be through us. I did do a survey with our Klamath Tribal Health staff to see what the interest level was, and it looked like 60% of our staff was saying they would be interested in the vaccine. I anticipate that number will start to go up now that there's actual safety data out showing that it is a safe vaccine, because that was the hesitancy before, was just not knowing a lot about it. And then once we, vaccinate and we have people, I know we'll have more vaccine that we can start giving to some of our high-risk population from that 150, because we don't have 150 healthcare providers. So we can have our team look at who our highest risk population would be our recommendation. Do the healthcare providers go into our highest risk population? Who are the people that really need this to make sure that they're safe? And then prioritize based on high-risk people that really need this vaccine to protect them. And then, start going down from there into the lower risk categories down that way.
Sure, thank you.
Chairman, this is Gail. I really like this conversation, and I want us to have more on it, but I still want us to have another meeting on this.
Yes.
And get to the rest of the items on our agenda, because we're rolling up on 11.
Yes, Member Dumont?
This is Clay. I appreciate what the Vice Chair is saying, so I'll be quick. I wonder if our health folks have considered putting together an informational flyer of some sort about some of the myths that are circulating regarding the vaccine. I saw that the Herald and News did that recently. I've seen it on social media. One of the ones I just encountered was we have members saying that the vaccine is going to alter their DNA. So, there are a whole lot of things circulating out there. I think it'd be good to try to counter some of that disinformation.
Yeah, absolutely. And I actually started working on that on a personal level last night with my friends and family on Facebook. So that's definitely something that I've been thinking about, and I'd be happy to get that going.
Yes, Member Palace?
And Missy, of course, I know you guys are already on the ball, and I appreciate your work. I imagine that tribal members, especially our vulnerable populations, are going to be asking what kind of accountability measures we have in place and how we're going to monitor the effectiveness and of course, any side effects that people will be dealing with. So we can go over that in our internal meeting, and I'm just always trying to think of what, we expect our tribal members to ask, and I appreciate Councilmember Dumont bringing up having a flyer, so I look forward to seeing all that.
Yeah, thank you. Yeah, in the follow-up meeting, we want to address this, anything that we can do to get out the information and even public service announcements and so forth. We want to, get all the correct information out to folks that are dispel the misinformation. So we'll set that meeting up. Looking forward to that. And thank you so much, Misty, and folks for chiming in. So let's put that on the back burner for now and take further discussion on that later. The Oregon redistricting as a result of the 2020 census, I'm not sure how to move this. I'm aware of that, but was there an individual on the council? Okay, Willa, did you want to bring that forward? I didn't know. Okay, thanks.
So I know you guys thought the census is over, but it's actually not. So part of the 2020 census is once they do the counting, which is in January, states have the opportunity to redraw their district lines. And so this happens every 10 years, even though the census actually does a population count every year. The decennial census every 10 years provides for that. So Oregon is looking at possibly gaining 6 more seats in the House of Representatives. And as most of you know, we're in a cracked district, and what that means is that they took the northern half of the county and put us into House District 55, whereas the lower part of the county is in House District 56. And this happens a lot for tribes on Indian reservations. What they do is they split up your population in half, so that way you don't have equal representation. So we see that in Oregon, where a lot of the southern parts of the state and, of course, the eastern parts of the state are really very Republican led districts. They have, over 80% of the vote here in Klamath County with both House District 55 and 56. So we're not getting our say in Congress, and what I'm asking of council today is to continue the work. The organization I was previously working with the census, We Count Oregon, they're continuing the work to do the advocacy for the redistricting. It's going to be a really fast process because of the way the Oregon Constitution outlines the redistricting process. It has to be done by July. So there's going to be an open public comment period, I believe, starting in January. So the tribe, if we're going to get involved in advocating for this, we need to be on top of it. I attended the kickoff meeting that We Count Oregon had on Monday. They're changing the name for this project to Redraw Oregon. And so I can go on and on all day, and I'm sure you guys all know we have racial and political gerrymandering going on here. And ultimately what the whole goal is that we need to elect leaders who represent tribal sovereignty, protect the environment, and ensure that tribes receive their fair share of resources for public services. And I imagine Chairman Gentry will be working on this in LCIS with the other chairs of the Oregon tribes. So I just want to get the blessing from Tribal Council to continue this work and work with Redraw Oregon, and that Tribal Council can help us start advocating. And of course, this isn't just a government issue, it's also individuals. So any individual tribal members and or staff members out there that want to be involved, we really want to encourage people to be civically engaged and really see how important, this process is, because what goes on right now is there's power and control in the hands of the few, and then we get left out, and then we have things that happen to us instead of being out in the front where we're actually be the ones making the decisions for our tribe and our people. So I think I would just need a motion to continue my work with the redistricting process, but it would be a continuation of the census project.
So I'd entertain a motion to have continue with, I guess it's redraw.
Yeah, redraw, they're redrawing
Yeah, redraw Oregon, Gail? Oh, you're making the motion? Okay, I just see your hand raised. Is there a second?
This is Ellsworth, and I will second.
Okay. Let's see, I think we could probably do this by voice vote. You know, all those in, yeah, what's that? I think, well, you can abstain or not, but I know you're working on behalf of the tribes. I think if we do voice vote, and I don't hear any folks opposed, then by voice vote, it'll carry. All those in favor signify by saying aye.
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 Okay, those opposed? 0 opposed with my abstention, and motion carries. Thank you, Will, I appreciate that. Okay, Treasurer, we'll turn this over to you, the Treasurer's budget report.
All I need is to, basically have the last budget report for November 19th ratified. I didn't get a motion to approve the Health and Administration budget report.
So I'd entertain a motion to approve the Treasurer's budget report for the last meeting,
For November 19th.
November 19th.
Mm-hmm.
Somebody like to make that motion? Okay, looks like Vice Chair Hatcher. Okay, is there a second?
This is Ellsworth, I'll second.
Second, Member Lang. Secretary, I'll let you conduct the vote.
Gail,
Yes.
Brandy, I'm assuming Brandy's abstaining.
Yes, I abstain.
Okay. Willa,
Yes?
Clay,
E.
Ellsworth,
Yes.
Jeannie,
Yes.
I vote yes.
Okay, of course, I think you've heard from everyone, and I abstain. So
Okay, so I have 602.
Okay, motion carries. And the other issue, Treasurer?
I was gonna have that check policy authorization done, and I haven't done it yet, so we'll do it at the next meeting.
Okay,
Okay, thank you.
all right. The next matter is the Cascade Health Alliance. Do we have information on it, or did you email it out, Secretary, I think?
I emailed it out, but I can put it up on the,
Oh, okay, that'll help us. Thank you.
I'm trying to find it. Make sure I have that. We met with Cascade Health Alliance at the 12/9 Tribal Council meeting. They presented that they're inviting us to submit names to for a community advisory council that acts as an advisory committee, making recommendations to the Health Alliance, and then also to accept their employee, Chris Koski, as their tribal liaison. And this employee will act as a primary point of contact with the OHA Tribal Advisory Committee. And so I've included that, and I'll read the whereases. Starting with the fifth one, it would be, whereas the Klamath Tribal Council recognizes that working cooperatively with other agencies within our community will positively affect the health outcomes for our tribal members. And whereas the Klamath Tribal Council believes that it is important to take opportunities to have a tribal perspective and participation on advisory councils that affect the health care that tribal members receive. And now therefore be it resolved that the Klamath Tribal Council approves tribal participation on Community Advisory Council for Cascade Health Alliance, and will put forward a name of the tribal member selected for this appointment to Cascade Health Alliance prior to December 31st, 2020. And now therefore be it further resolved, the Klamath Tribal Council accepts Chris Koski as the Cascade Health Alliance Tribal Liaison. The CHA employee will act as a primary point of contact with the OHA Tribal Advisory Committee. So,
Yeah, Chris, there's two issues here. There's a staff person there, Chris Koski, who's native Alaskan. That's what this motion addressed, but we also have opportunity to appoint somebody representing the Klamath tribes. And so do we have to name that individual in this resolution, or just provide that by the 20th? I think that's the way it reads.
yeah, since we hadn't developed that short list or asked anybody to participate on that, I just put it as a general that we're going to give them names or a name by the end of the year.
Okay. So I think we can approve the motion as, and if we have the motion, resolution as if you've provided it, then we can have discussion with folks on who that person might be, and maybe we can come to an agreement on that. So there were some individuals, well, let's consider the motion first, and for the resolution, and then go from there and have further discussion. Would that work, folks?
This is Brandy. I will make that motion to approve the
Okay.
resolution.
And it'll be 2020-044.
Okay, to approve resolution 2020-044.
Okay, is there a second? I don't
This
have.
is Ellsworth, and I'll second.
Okay. Secretary, if you can conduct a vote.
Gail?
Yes?
Brandy?
Yes.
Willa?
Yes?
Clay?
EE.
Ellsworth?
Yes.
Jeannie?
Yes.
I vote yes.
Okay, and of course I abstain according to the tribal council bylaws. All right, the
So that
motion,
will be 701.
okay, so the motion carries. Thank you. So there is an opportunity, and when we met with Cascade Health Alliance, there's some folks' names that came up, but we haven't had an opportunity to talk with them directly or see how that would work with their current position. One is a staff member in tribal health. Monica Yellowow's name was mentioned. Also, Dr. Hill, the chair of the Health Advisory Committee. There may be others. Those are just the two names that came up at that point. And haven't had communication directly with those individuals. I think there was an email that came out, and I didn't hear back from Dr. Hill or didn't have a discussion with Monica. But what the council wishes on how to move forward with this.
I would think that we would have to get, yes, they want to do it. In the case of Dr. Hill, and yes, there's availability for a staff member to do it, because that may be more duties than the staff member has time for.
Yeah, I think that's the overall concern with a staff member. They've got a lot going on. Can you remind us, Secretary, or folks, if they remember how much time would be involved in participating on that council? Does anybody recall?
I'd have to go back and look at the recordings.
Okay. I think what we could do is just follow up with this, send email communication out with some prospective names if there are others, and then we'll follow through and contacting them and finding out their availability with their supervisors to see if that could work. Follow through that way. Is that the best way we can handle this, folks? Okay. I think so. I think that will work. Let's follow up that way and make sure we get email out to folks, and certainly need to, vet with their supervisors and directors, make sure it's if it's a staff person, they have the time available. In the interim, I can call Dr. Larrabee, if you're comfortable. I could call and talk with Monica directly to see if she's even interested. Certainly want to clear that with you. And I could call Dr. Hill also. I actually have a note to follow up with them.
And also, Monica is supervised by Dr. Adams.
Oh, yeah, Dr. Adams, yeah, that's correct. So I'll get that blessing coordinated with Dr. Adams also. So are there other individuals that we want to, pose this opportunity to? Okay. All right, well, I'll follow through with that and report back to the council, and we'll figure out where to go from there.
Yeah, there was a mention that there is Brandon Tupper. He's appointed to the OHA's tribal liaison capacity. So he would be working with Chris, but is there also somebody from some other employee also that may be more in the medical field that if it's not Brandon, it could be somebody else.
Okay.
So I would just point that out.
Okay. All right, maybe I'll follow up with Dr. Larrabee too, to see if we can get some potential others to consider.
Yeah. Yeah.
Okay, then I'll probably send this out email. That way we can keep the tribal council looped in.
So that's all I have.
Okay. Well, thank you, everyone, for participating today. That brings us through the agenda. I'd entertain a motion to adjourn.
So moved.
Okay, motion by Treasurer Hatcher. Second? I've never seen anybody be hesitant to adjourn.
I'll second.
Okay, Secretary Frost. All those in favor say aye.
Aye. Aye.
Aye.
Those opposed? With 0 opposed and my abstention, motion carries. Thank you, everybody, for joining. Thanks, Joe. Thanks, members, for joining with us today. Have a good rest of your day. Thank you.